Let's queer up breaking trans news. U.S. House passed defense spending bill which ends trans youth health care. The House of Representatives has passed the normally routine and bipartisan National Defense Authorization Act, providing $884 billion in military spending. The spending measure passed with an unusual number of no votes. On a vote of 281 to 140, with 124 Democrats and even 16 Republicans voting against it. The reason was added language on a provision denying insurance coverage for gender-affirming care for transgender children of service members. The controversial provision in the Act would prohibit coverage under the TriCare insurance plan of any medical intervention for gender dysphoria that could result in sterilization for anyone under age 18. That would mean an end to care for any military families using TriCare as their health insurance. The bill now goes to the Senate, which has a narrow Democratic majority. Breaking Defense reports it is still expected to pass, and President Joe Biden has pledged to veto any anti-trans legislation. Civil rights groups and Democratic politicians quickly condemned the House's actions. Critics and LGBTQ advocates point out a glaring contradiction of Republican support for parental rights and personal family decision-making. And I think that last point there really sums it all up. They want to push parental rights, they want to push family decision-making, and as long as it's a decision that we want you to make.
It was interesting as I went and did a little bit of research to see out if there's another plan available to military and folks, whether they have to be on the what's it called? TriCare, or whether they can use a different VA or something. And it appears it's the only one. The other thing that was interesting is that the story says it's for the children of. It doesn't talk about military personnel who themselves are going through the change, the heat, the waves, the change that are, have chosen to make a decision and go through the transition. And so I found that both of those things kind of interesting, is that they're left out. Mm-hmm. But I also was hopeful that we saw so many Democrats and some 16 Republicans vote against it. But will it make a difference?
But the question I have is, and this goes to similar situations in the past. How many families are we talking about? How many children are giving consideration to transgendering?
Right.
We're talking 3? We're talking 5? The number is so small that it's ridiculous. Because right now the trans community represents less than 0.09% of the population. And it's been, in my research, I've learned that children that are considering transitioning are even smaller. It's like 0.004%. So we're talking about nothing in the scale of $884 billion.
Seriously. Right.
So what is the goal here? Is it just to screw everything up?
It's to make a statement, just to put it out there. Like most things, they exaggerate how many people are affected. Right. In the meantime, for that one kid that's trying to do this, it is their life, and it means everything to them, which is what you're alluding to.
Right.
Like, what would it cost us to take care of a couple of people?
Exactly.
Even if it was 5,000 people, compared to the number of people in the military, it would still be a drop in the bucket.
But at the same point, it's not just the Republicans trying to screw these particular families, but it's also, for the Republicans having so much bravado and noise about we are military pro and we are pro police and we're pro. Every single time there's a vote for anything, the first thing they do is they slap on a transgender. They slap on something that 4 people are, a percentage is even infected, and we're going to stop every cog in the wheel to discuss nothing that matters.
And we do have to always mention at this point too that every major medical organization says that this is stupid.
Right.
Essentially, like they support professional care for people who want to transition, no matter what age.
I think there's something to say when the government has so much to input on your child's life and what you guys have going on in your household.
Well, and that's again going against the Republicans who want smaller government, but yet they want to know what you're eating and what you're wearing and who are you sleeping with and what doctor you see. Give me a break.